5 things that are considered obstetrical emergencies and why. Number 1, a cord prolapse. So basically, when your water is intact or the water's not broken, the cord and the baby are just kind of floating freely in the womb. When your water breaks, they kind of lose that cushion. What can happen is the cord can actually come down under the baby's head out through the cervix, meaning the baby's head is up here, the cord is down here. It can actually get compressed. It's an emergency because the baby's head compressing the cord is basically cutting off its own blood supply. Number 2, a placental abruption. A placental abruption is considered an obstetrical emergency because this is where the placenta detaches from the uterus. The placenta needs to be attached to the uterus because that is how mom is providing everything for baby. So when the placenta detaches from the uterus, essentially it is cutting off everything that the mom is then providing to the baby. Number 3, a uterine rupture, and this is exactly what it sounds like, where the uterus actually ruptures open and basically opens up into the abdominal cavity. This is more common in people that have had previous C-sections and where that C-section scar is, but this is considered an obstetrical emergency because everything that's supposed to be inside of the uterus is now exposed to the abdominal cavity, and essentially you're now bleeding out into the abdomen. Number 4, an amniotic fluid embolism. If you didn't know, amniotic fluid can actually enter into the mother's bloodstream and end up somewhere in the body. These cases are pretty serious and need to have immediate intervention to prevent potentially fatal complications. It can really happen at any time during labor, and then most commonly up until about 30 minutes after delivery. Later than that is usually rare. Number 5 is a placenta previa. Now, placenta previa is actually where the placenta is covering the cervix. So the cervix is supposed to be where the baby comes through, but instead the placenta is actually covering it there. There's nowhere for the baby to get through without going through the placenta. Placenta previa itself is not the emergency. When you go into labor and the baby is trying to come out, this is when it becomes an emergency. Because remember, the placenta is composed of both vessels that are going to mom and baby. So if your cervix is stretching and that is ripping, or the baby is trying to go through that, we're risking severing all those vessels and potentially having mom and babies bleed out. This is when it becomes an emergency. Not making this video to scare anyone, not making this video to freak anybody out. Hear about labor and delivery or obstetrical emergencies all the time, and sometimes you don't really understand what's happening. Just shedding a little bit of light behind the things that can happen in labor and delivery and why they're actually considered emergencies.